Record. No, it didn't.
All right. Well, Dr. Turner, we're continuing on our discussion. I really appreciate you sharing all of your knowledge with us. It's been a wonderful journey since I've met you, and you've helped me help a lot of patients. So let's turn our attention now to sleep. I always tell my patients, Dr. Turner says we need 8 hours and 10 minutes of sleep every night. Are you getting that? So please talk to us about sleep.
Sure. In fact, it's not only 8 hours and 10 minutes, but there should be no waking up to go to the bathroom during the night, and it should be uninterrupted, complete deep sleep. Sleep goes through stages. I think there's 6 stages that you go in and out of in that 8 hours. And each stage takes you into different stages of sleep, very deep sleep, shallow sleep, REM sleep. And so you have to go through that cycle. I think it's 6 times. Do you remember how many times it is, Dr. Mann?
I do not. I would have to look that up.
Yeah, but it's about 6. You got to go through that cycle 6 times. If you don't get through those cycles 6 times, you are sleep deprived. In other words, if you get any less than 7 hours sleep, you are sleep deprived. So, to help that, we can give you a number of different things and don't forget that your estrogen controls your melatonin. So we'll talk about melatonin first. For a perimenopausal woman and a menopausal woman, what do they say to you, Dr. Mann?
I can't sleep. I need help with sleep. I fall asleep and I wake up. I can't go back to sleep.
That's
We
right.
have all sorts of sleep disorders.
And it's driving them nuts.
Mhm.
Crazy. Exactly, because if you don't get enough sleep, you cannot make sane decisions. In other words, the estrogen in menopause interrupts your ability to sleep. So we have a solution for that. So it is called melatonin. We give the patient melatonin, very low dose, at least 1 hour before bedtime, because we don't want them to have an overhang when they wake up in the morning, along with a thing called Trimag, 3 different types of magnesium to relax the muscles. Now that is what keeps you asleep. To get you to sleep, if you're having problems getting to sleep, which is 2 completely separate problems, which is called tryptophan and serotonin. So cortisol comes along and it triggers you to get up out of your chair at night and say, I'm tired, put me to bed. And then the first thing that trips in is tryptophan. That's when you're getting tired, you go and you clean your teeth, have a shower, whatever you do, and then you jump into bed. If you fall straight to sleep, that's an adrenal problem. You should never fall straight to sleep. There's a 10 to 15-minute gap when the serotonin gets in. That's when you may want to read for 5 or 10 minutes, or you snuggle up, talk to your husband, and you get comfortable. And slowly you drift off into la la land as the melatonin kicks in. So it's a cascade of hormone responses from cortisol, if you have enough reserve, to tryptophan. Tryptophan is why you get sleepy when you eat turkey, a big turkey meal. That's got a lot of tryptophan in. Over to serotonin. That's when you're in bed and you're in your sheets and you're getting nice and comfortable. You're either reading a book or you're talking to your spouse. And then melatonin. And melatonin, once that kicks in, you've got to go through those, I think it is 6 sleep cycles for 8 hours and 10 minutes per day. Now, I happen to be, without any of those drugs, an 8 hour and 10-minute sleeper. Exactly. I mean, I don't know why I do it. I mean, it just built into me. So the 8 hour and 10 minutes is built into us. And when I get up in the morning, I'm refreshed. I want to run a marathon. In fact, I get up and I put my exercise gear on straight away. I'm out the door. I'm full of energy. So you too can do that as well. We use magnesium to calm the muscles down. Magnesium, and if you have any sleep problems, we move the D3, which we like you to take in the morning, into the evening. So you take the magnesium D and your D3, instead of taking it in the morning, you take that in the evening, because that also induces sleep as well. So the magnesium, the Trimag is 3 different types of magnesium that do different things in your body. It relaxes all your muscles. Now, don't forget that if you get adequate sleep, sleep equals weight. So if you're not getting enough sleep, you're going to put on weight, right? And I know that a lot of your female patients do not like putting on weight,
No, they
right?
don't.
Um, Sleep affects your decision making. If you're sleep deprived, less than 7 hours sleep a night, and I can see all those women out there listening to this right now, they're all putting up their hands. That's me. That's me. Then it affects your decision making. But listen to this. If we all have cancer cells in our body right now, and the immune system is going around and gobbling them up, right? Lack of sleep triggers the inability of the immune system, because your immune system becomes depressed, to allow cancer cells to propagate. And I want to end it there. Thank you.
Very good to hear all that. Thank you, Dr. Turner. Let's continue on our discussion, please, Dr. Turner. Let's talk next about some of the autoimmune components of thyroid disease.
Okay. Autoimmune is triggered by mistreated, undertreated, undiagnosed thyroid conditions, either hyperthyroid or hyperthyroid. Quite often it runs in families. So, and some of it has a genetic component to it. So you can be predisposed to an autoimmune condition. Let's talk about the easiest one first. I mean, there's the one that's only affects 2% of all of your patients. And I know it's quite rare for you to see it. That's Graves, right? The Graves protocol, which is identified with a blood test called TGAB, our protocol doubles the effectiveness of the anti-thyroid medication that we must give you, methimazole. The protocol, if it doesn't work, the protocol will lead you to a thing called a partial ablation, where they take out part of your thyroid. With Graves, up until we came out with our protocols, it happened to 2/3 of all patients. Our protocol means that only 1/3 of patients have to have a partial ablation. So we double the effectiveness. We've doubled the effectiveness of the medications that we have to use on you. Hashimoto's. 18% of all your patients will have Hashimoto's. Hashimoto's is the most common disease, and in my clinical trials on 2,200 people over 3 years, I accidentally discovered or stumbled across the how to not only put it into remission within a very short period of time, but how to totally cure it. My wife, she hates me talking about her on these interviews, but my wife had Hashimoto's. She's been Hashimoto's free, that is, including all the joint effusion and the joint pain and the aches and pains and all the digestive problems and all the memory problems she was suffering from. That today she's free of all those, and she has zero. Every time we run the antibodies test, we say they are totally free. She's totally free of any antibodies. So I lived with someone who had Hashimoto's, who is not in remission. It is totally gone, and that is what I discovered. So we treat tens of thousands of patients every year worldwide with this protocol, and we haven't had very many failure rates with the treatment, because some of them do have hashitoxicosis, which I'll cover in a minute, which is a genetic component. But good news for you, for the 18% out there, not only can we identify it, we can reverse it and we can treat it. It takes 1.5 years for us to 2 years for you to totally get autoimmune free with all the cascade of autoimmune responses. But it is very good news. It's the only treatment of its type in the world. Next is hashitoxicosis. Hashitoxicosis is when you have both Graves and Hashimoto's. Why do you have that? Well, we found out that there's a DNA genetic component. In other words, your parents most probably had it, or your grandparents most probably had it, and it's 0.5%. So very few of you out there have hashitoxicosis. The treatment is we do a genetic DNA test. We send you out a little kit, and we take a swab from the inside of your cheek. We then do an inflammatory and autoimmune set of and digestive set of tests, and we then have specially medications to treat the genes. In other words, you cannot change the genes unless you snip them as from birth, because you've got too many genes to change. But we can mitigate the response to the genes with our range of selected medications. As I said, it's only 1/2 of 1%. So you don't come across it very often. But I actually treat a lot of people in the Middle East, and it's rampant in the Middle East. I mean, we have quite a big practice. We see a lot of patients there, and it's very, very common. And it's the first time I'd come over where the majority of the population has hashitoxicosis, and we've been very, very successful. If you have autoimmune disease, the very first thing that Randy's going to tell you is you have to go outside, go across to the bakery across the road, have a nice big cream bun, because that's the last wheat, gluten, dairy, and sugar you're going to have for the rest of your life. We have to put you onto a paleo diet. If you have a weight issue as well, we're going to not only put you onto a paleo diet, but we're going to put you onto either the 16-8 or the 5-2 intermittent fasting diet as well, because the paleo plus that is going to alter your weight as well. So that's one of the unfortunate or the fortunate side effects. But I live in a totally, because my wife has had Hashimoto's, I live in a paleo household, and it's quite easy for us to enjoy and eat. Just to let you know, paleo is a way of eating. It's not a diet, but the intermittent fasting is a diet. Yeah. But did you know that on the 16-8, between the hours of 12 and 16 of the fasting, that's when it mainly affects your blood sugars and the fat burning. So that's why those hours are very, very important. So there is help out there, and we have the tools, and we've been very successful with it for the last 21 years. Thank you, Dr. Mann.
My household is also gluten-free. We're not always paleo, but yep. And we feel a lot better for it too.
Excellent. Thank you.
Sure. Thanks, Dr. Well, Dr. Turner, you have been a wealth of information about thyroid disease and treatments, and I really appreciate you sharing this with all of us. Our last segment, I wanted us to talk about the stress modulators. Would you go into that, please, for us?
Sure. When we balance the thyroid, not only must we get enough iodine, the adrenals balanced, and your sleep right, but we must balance what is known as your stress modulators. These are the main ones, DHEA, and of course, D3K2, I'll start with that, is a must. Why do we put K2 with D3? The D3, which is 5,000 international units, boosts the immune system. It's the major surveillance for your immune system. In fact, in these times of COVID, we highly recommend a high dose of D3 beyond the 5,000 if you go out into crowds, but I won't cover that right now. But the K2 also strengthens your bones, so there's a benefit. We don't want you to take calcium. We want you to get the calcium out of your food sources and let the D3 take it into your bones, and the K2 acts as a plug, so it doesn't flow back out. Now, the D3K2 makes the thyroid work, as I explained earlier. It is the receptor pathways that must get into your mitochondria, and that's both the thyroid medications and the iodine. They get into your mitochondria inside of your cells, and all those. They're little these are your engines that drive you. So the D3K2 is vitally important for that as well. If you have sleep issues, you move the D3 from morning to night. It helps with sleep. So D3 has a myriad of other uses, but mainly in and amongst the stress modulators and the thyroid, D3 is absolutely essential along with iodide. The next one is the DHEA. The DHEA, and I'll just cover the pregnenolone. They're both the precursors to estrogen, progesterone, testosterone. So, thyroid controls your estrogen and your progesterone. Unless you have your thyroid balanced, it's very difficult for you, Dr. Mann, to balance a woman's estrogen and progesterone. So it's like a cascade. You got to start with the thyroid, get that balance, and then you can go down and address the estrogen and the progesterone and the testosterone. So the DHEA and the pregnenolone, not only are they involved in the stress modulators, but they're also involved in the controlling of your estrogen and your progesterone. That also gives you your libido back as well. And the next one is GABA. GABA is a neurotransmitter. So we measure the speed of the neurotransmitters on the thyroid flanks. If you're having problems with your brain function, there's difficulty with math, mood swings easy, more difficulty thinking, unsteady gait, shakiness, etc., and you cannot tolerate noise. In other words, noise really, really annoys you, then you have a GABA deficiency. So we give you GABA if you answer that question of noise intolerance. Finally, the bees. Well, as you know, the bees in the multitude of bees, some of them being renamed into with other names, but the multitude of bees we actually give you a thing called activated bees, so they don't get destroyed in your digestive system. They play a major role in not only in other function in your body, but they play a major role in your adrenals. So the bees, that's the last thing we give if your adrenals are really, really bad. And we can, if the tablet is not good enough, we might even, Dr. Mann may even suggest a shot of bees or a Myers cocktail or something else like that if you're really bad. But usually we can get away with the tablet form of the bees. But the stress modulators are there to help us balance all the in-betweens between the adrenals, the sleep, and the functioning of the thyroid. Thank you.
Wonderful. Thank you very much, Dr. Turner. This was really educational. I'm sure that anyone that watches this will be amazed at what you guys do and what you've done worldwide. And I know that we've helped literally thousands of women here at Wise Woman because of your help. So thank you. Thank you very much.
Dr. Mann, it's been an absolute pleasure to share this information and get this information out to as many people as we can, because I thoroughly enjoy, the reason I do this work, I still do it at my age, is I enjoy the outcome of how it improves the quality of your life. We don't want you to have Alzheimer's. I mean, if you don't correct your thyroid, you double your chance of getting Alzheimer's, let alone all the shaking disorders, the Parkinson's-like diseases, where you're trying to have a cup of tea when you're older and you're shaking, let alone your memory going. You're sitting in a bed wondering who the people are around you. You can avoid all that. We won't say you're going to live any longer, but you're going to live, you're going to die at 90 something or other, playing tennis on a tennis court, not sitting in a bed wondering who the people are. And the hormones play such, I mean, we've just talked about the core hormones here, but I'm talking about all the hormones, which I take personally as well. But the estrogen, the progesterone, and all the other hormones that we do play an essential part in the quality of your life. The reason that we didn't have to worry about this field is that when I was born in the 1940s, the average life expectancy for men and women was 63 years of age. My grandfather, that's my father's father, died at 59, and that was normal. My father died last year at 95, hormoned up, right? And still working.
Wow.
With his own business. He died of old age, but that's how we want you to die. Not and still going everywhere and still traveling. It's about quality of life, and this is what the hormone. So you can expect to live another 20 or 30 years longer now. I mean, I'm old now, and I expect to live another 20 years or plus more. And I want the quality, I want my brain functioning. I want to be able to hike every morning. I want all the quality things that I'm going to miss out on if I don't address my hormones. Hormones give you the quality of life.
You're so right, Dr. Turner. We didn't even touch on fertility and IQ of children. It's very difficult to get pregnant if your hormones are not right.
Absolutely, yes. And the thyroid controls the estrogen and the progesterone. So many times I've heard I mean, I've been told by women, not myself, but you treated my thyroid and I fell pregnant straight away after having 2 or 3 or 4 miscarriages, right? And of course, the IQ of children. I mean, iodine. There was a lot of other things we could cover. This only these are quick segments, but sure. Preconception, you give a female patient iodine, 12.5 milligrams, and she will be born with a baby that's 10 to 12 basis points or 10 to 12 points higher on the IQ scale. If the baby's going to be born with 100, you'll be born with 110 to 112 IQ or any variation of that. It makes a major difference in the wiring of the brain.
It does. And even a couple points on the IQ scale make a difference from an A student to a C student. So we definitely
Absolutely. In fact, 10 to 12 points makes a difference for the rest of their lives. They don't have to struggle. Yeah, they don't. With the higher IQ, the much better chance you have of having a beautiful life.
Well, Dr. Turner, this was wonderful. Thank you very, very much. I appreciate you taking the time out of your very busy schedule. I know you travel the world and help people all over the world, from Dubai and the Middle East to China and Malaysia, and it's a wonderful thing that you're doing. So thank you. I appreciate this very much.
And Dr. Mann, thank you very much for having me be able to broadcast this to your patients.
Absolutely. Thank you. Bye-bye.
Bye.